And the host of this year's Mayor's Conference joins me live, Mayor Hillary Schieve of Reno, Nevada. Mayor Schieve, thank you so much for giving us some of your valuable time here. First, talk about why it's important for mayors from these various cities to gather.
Well, obviously, we're a tight group of folks. We certainly learned that during the pandemic. We all come together. It doesn't matter if you're a Democrat or Republican, or like myself, I'm an independent. We always say there's no Democratic or Republican way to clean a street. So mayors convene, we collaborate, we come up with solutions. We are the ones on the ground who can act, the quickest, right? We move fast, we move frequent. So mayors really get it done in our cities. I think we proved that during the pandemic. And we're just lucky to be able to collaborate with each other and come together. We typically have the same issues, just different populations. But as we move in this coming year, we're going to work incredibly hard on what I've been calling America's dark secret that we have not wanted to talk about for decades, and that's mental health and addiction. And mayors are seeing it tenfold. We just did a mental health survey. We're going to be working with the Surgeon General collaboratively, but 88% of mayors said that they don't have adequate resources to address the mental health challenge that we're seeing. And part of the biggest issue is that funding goes to states and counties. And so we're going to be fighting for federal legislation to make sure that it comes to our cities where we need it the most. We've got to stop treating our jails as mental health hospitals. This is a staggering statistic. We know 49% of ages 18 to 24 said that they're experiencing anxiety and depression. That is almost half of that age group. What does our future look like? What does our economy look like if we don't get on top of this mental health crisis? And if you know anyone, a loved one that needs treatment, it's incredibly hard to access. It's expensive. It doesn't exist. Certainly, even if you have insurance, it is very hard to access mental health care. So we've got to do a better job.
Mental health care is linked to so many other issues, right? You talk about the lack of mental health care. We've talked about crime. We talk about immigration. Nancy mentioned the aging rail system. For you in your city of Reno, what is the biggest obstacle, and how does that kind of compare to other cities that are similarly sized?
Right. Well, you hit the nail on the head. It is sort of connected to everything. In my city, it's been incredibly frustrating. I've been trying to open a 24/7 mental health care facility for 5 years. And I've been working with the state and the county, but it's finally now coming to fruition. And that's my point. Cities can't wait. This is where it's affecting us most at ground zero. We have got to stop using our jails as mental health hospitals. When you take someone to an ER, they fix broken bones there, not broken brains. And so we have to take a completely different approach. Our policies are failing. We've been told that we can build our way out of it with affordable housing. That's not true. We have got to offer comprehensive ways and case management services so people can have sustainable housing. If you don't have great mental health care, you will not have a great city. And mayors are ready to invest, and we want to hit the ground running. We really believe it's one of the top crises in the country we're not talking about.
Well, and it's certainly something we hear so many leaders all across the country talking about. We certainly hope that there are some viable solutions, some plans that come out of this. Reno Mayor Hillary Schieve, thank you so much for your time. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.